Afternoon. I'm Alan Solomon, the Dean of Tufts University's Jonathan M. Tisch College of Civic Life. Welcome to today's virtual Civic Life lunch, entitled COVID-19 in Boston, Running a City During a Pandemic. We're pleased to welcome three of Boston's municipal leaders for this conversation: the Mayor of Boston, Marty Walsh, the city's Chief of Health and Human Services and a Tufts graduate, Marty Martinez, and the city's Chief of Equity, Dr. Karilyn Crockett. Today's program is Tisch College's third Civic Life Lunch of the semester. Last week, we featured Rachel Kite, the Dean of the Fletcher School of Law and Diplomacy, for a conversation on climate change. Just yesterday, we hosted PBS White House correspondent Yamiche Alcindor, and this Friday, we'll have a lunch conversation about last night's presidential debate, if you want to call it that, with Republican political strategist Scott Jennings and Democratic strategist Robbie Mook. Tomorrow, as part of the Tisch College Distinguished Speaker Series, we welcome social activist and CNN political commentator Van Jones. I hope you'll join us for that conversation. You can go to tischcollege.tufts.edu/events to register for any of our events and to see our full lineup of speakers. Tisch College is excited to present all of these guest speakers virtually to the Tufts community. We know right now it can be harder than ever to stay connected, informed, and engaged in civic life, but it's also more important than ever. Recently, Tisch College's Center for Information and Research on Civic Learning and Engagement, known as CIRCLE, found that 79% of young people under the age of 30 say that the COVID-19 pandemic has made them realize how much the decisions of political leaders matter to their everyday lives. We have a valuable opportunity today to hear directly from some of the leaders who've been making those decisions here in Boston. So let me introduce each of them much more briefly than they deserve so we can get right into the conversation. Marty Walsh is the 54th mayor of the city of Boston. He's currently serving his second term, which began in 2018. Mayor Walsh was born, raised, and still lives in Dorchester. He's a former labor leader and state representative who, since taking office as mayor, has focused on issues, among others, concerning education, housing, economic inequality, and substance abuse. In fact, the mayor created the nation's first municipal office of recovery services. He also launched Imagine Boston 2030, the city's first citywide plan in half a century, and the first cultural plan for the city of Boston in a generation. The other Marty on our panel today is Marty Martinez, who's the city's Chief of Health and Human Services, which has 10 departments and is the largest agency in the city government. Marty Martinez has had a long career in youth development and public health, including as CEO of the Mass Mentoring Partnership and in senior positions at the Boston AIDS Consortium, the Regional Center for Healthy Communities at Mount Auburn Hospital, and in the city of Somerville, where he led youth services. I'm proud to say he is a Tufts alumnus, having received a master's degree in urban and public policy from the Department of Urban and Environmental Planning. Our third panelist is Dr. Karilyn Crockett, the city's first ever Chief of Equity, a cabinet level position created by Mayor Walsh. The Chief of Equity is responsible for embedding equity and racial justice into all of the city's plans and operations. Dr. Crockett previously served as Director of Economic Policy and Research and Director of Small Business Development for the city. She was a lecturer of public policy and urban planning at MIT, and her research focuses on the social and geographic implications of structural poverty. Dr. Crockett was the co-founder of Multicultural Youth Tour, or what is now known as My Town. My Town is an award-winning Boston-based educational nonprofit organization that hires public high school students to research their local and family histories to produce youth-led walking tours for public audiences. It's my honor to welcome Marty Martinez and Dr. Karilyn Crockett to Tufts, and to welcome back to Tufts and to Tisch College Mayor Marty Walsh, who was one of our early distinguished speakers when we began the series in 2014. So I'm going to kick off the conversation with some questions for each of our panelists, and then we'll take questions from our Zoom audience. Please keep an eye on the chat function for instructions from my Tisch College's colleagues about submitting your questions via the Q&A feature at the bottom of your screen. Mr. Mayor, by about mid-March, life in Boston and indeed across the country came to a screeching halt. What was it like in those early weeks and months combating the pandemic, and how has the day-to-day reality of running a major American city changed as a result? And now that we're almost 7 months into the pandemic, how has your response changed since March?
First of all, Alan, thanks for having me today. To all the participants, thank you for being here today. I just want to warn you all, the two Martys are great to have on this panel, but the true rock star is Dr. Karilyn Crockett. So whatever we say, she's gonna, just, it doesn't matter. So I just want to say thank you, Karilyn, for being on here to make us look good, at least try to make us look good. February 2nd was the first case of coronavirus in Boston. It was at UMass Boston. March 6th was, I think, the 6th case of coronavirus. And about 3 days later, we were faced with decisions like closing schools, school buildings, canceling the St. Patrick's Day parade, which is a big deal for a lot of people, postponing the marathon, stopping construction, making some really complicated decisions by the end of March. Literally in a 2-week period, we went from being a fully functional, exciting city with all kinds of college students and all kinds of people to literally a ghost town. But it was important that we listened to the science, and it was important that we took action because lives were at stake. Our efforts worked and are working. We've flattened the curve, certainly since the peak, save lives. And we're conserving valuable resources here in the city. We're reorienting a city life of 700 people while trying to keep kids fed, engaged, caring for our most vulnerable folks, keeping our city running. I just want to give you a quick, and I'll be fast. Alan, just shut me down if I'm going too long. I don't mean to. You can literally cut me off, but let me just real quickly. This is what we did. We brought in the Crystal Group because the city of Boston never dealt with a pandemic like this. They made me in 1917, 1918, but there's no one around to talk to about it. And we thought about how do we create our city operations. We immediately set up a daily text message alert system with critical information in 11 different languages to about 100,000 residents. We brought, Marty and his team brought COVID testing to 18 community health centers right off the bat. We built a hospital, Boston Hope Medical Center, in 5 days in the convention center. In the very early stages, we were seeing that African American and Black people were testing at a 44% positive rate for COVID. Latino community at that point, I think, was 27%. We created a health inequities task force and an immigrant collaborative to target resources for vulnerable communities, because we saw the immigrant community, intergenerational families living in an apartment and having basically a barrier to getting information. We put together a citywide food access system. We took people from the Boston Planning and Development Agency and put them in with our food access office so that we could distribute over 3.5 million meals to families and seniors in need throughout the city. We funded 1,000 child care seats for essential workers, first responders, nurses, doctors. We in the very beginning, if you all remember, the PPE wasn't available. We worked to send 700,000 units of PPE to outside partners like nursing homes in Boston, community health centers, domestic violence shelters, homeless providers. We actually snuck in, helped other cities and towns as well with it.
Mr. Mayor, if I appreciate, you said to cut,
I
jump in because what I want to do is, this is obviously something that's felt locally, but it's a responsibility of government at different levels. And I wanted to ask you to maybe comment on what you think the responsibility is of the national government and the state government in the face of this crisis, and how do you think the federal and state governments, in your estimation, have lived up to their responsibilities?
Great question. The way that the structure should work in a pandemic, you have the national government that helps and works down through the states, which works down to the cities and towns. Whether it's creating systems for giving ventilators out or equipment, or giving us information alone. In this particular case with COVID-19, that did not happen. It was from the bottom up. And I can speak for Massachusetts because unlike other cities and states, the same thing didn't happen. Here in Massachusetts, I immediately started talking to the governor. Martinez immediately started talking to Mary Lou Sutters from HHS. Catherine Burton, my chief of staff, immediately talked to Kristen Lepore, the governor's chief of staff. And we literally had no oxygen between us from the beginning because we felt it was important for us to send messaging to people to let them know that we're on the same page. When we talk about PPE, we weren't getting it from the federal government. We were getting it, trying to buy it our own. And the city of Boston stepped up in a big way to help the state, who's responsible for nursing homes and places like that. So there's a major fundamental breakdown in the national government, and there still continues today when you talk about testing. But in Massachusetts, I think one of the reasons why we've been able to kind of hold it together, if you will, is because we've collectively worked very closely together. We're not criticizing each other and working through the shutdown together. And then as we reopen, the governor recognizing that cities and towns are in different situations. So for example, yesterday, the governor announced phase 3, step 2, I think it is, Marty, you can fix that. And we're not moving forward with that phase because we're about to go into the red in Boston potentially today. So we've been very, very close in working along this and coming up with our response. But the federal government really, the system for it, and you know this, Alan, from your days in the federal government, it's been a complete breakdown in the federal government. Mixed messages out of the CDC, mixed messages out of the White House, mixed messages, quite honestly, from the president. And that continues today.
Well, we appreciate the work that the city's done and that the state government has done. Chief Martinez, the mayor mentioned sort of disparity or the incidents, the higher incidents in communities of color. The pandemic has certainly laid bare disparities in the health and safety of Boston's most vulnerable. So how's the city trying to protect its underserved residents who are being the hardest hit by the virus? And what progress do you think you can make during the pandemic to reduce these underlying disparities?
Yeah, no, I think that's an important question, Dean, and I think it has been central to how we've responded. I mean, there's no question, as the mayor said, the inequity of COVID, the inequitable impact that COVID's had has sort of played out in our neighborhoods. It's played out in our hospitals. It's played out very specifically around the physical health and well-being of Bostonians, but it's also played out on who's needed support around food, who's needed support around housing, who's needed support for all the things that we've had to sort of scale back on to keep our community safe. So the city early on, has been really clear that we're going to look at data, we're going to understand where the gaps are, we're going to understand where the impact is, and then we're going to address it. The mayor in early April created a COVID-19 Health and Equities Task Force that meets every week. That task force is made up of healthcare leaders, community leaders, folks that represent and reflect the diversity of Boston. And every single day, they are working with us in partnership to understand what does the data tell us, where's the disparities, not only by neighborhood, but by zip code and by where people have access and where they don't. So for example, early on, we saw the African-American case rate be very high in the city of Boston. And we still see that at about 33% of all cases are African-American, higher than their population. And then in the last basically 2 months or so, 2.5 months, we've seen the Latino case rate dramatically climb up to that same percentage. And we continue to see that today in those communities. And so what we've tried to really do is be very transparent about data, very transparent about what we see, and be clear we need to roll up our sleeves and solve this together. And we're living with COVID. And when you live with an infectious disease, it means that folks are going to be disproportionately impacted. These inequities existed before COVID was in front of us. They've been exacerbated by it, but the mayor and team, we've been committed to making sure that we leave COVID in a more equitable way than we enter it. And so that's about being clear about investments of resources, lifting up supports, and making sure that no one gets left behind as we struggle with the pandemic like no one's ever experienced here.
Thank you. I want to talk a little bit more broadly about race and racism. Mr. Mayor, yesterday you spoke to the Boston Chamber of Commerce and you made a call to end systemic racism. What specifically do you want the business community to do in this regard? And then I'm going to turn to Dr. Crockett about a piece of her work, but give us a little bit about what you were asking of the business community yesterday in some specific ways.
Yeah, you know, I gave a speech at the chamber in 2016. We talked about systemic racism. We talked about being more engaged in the conversations around racism and having a more concerted, more focused effort. What we've learned about the opportunities of this pandemic is that we can't return to a normal life after this. We have to build a new and better normal, one that's inclusive, that lifts everyone up. And one of the things that I talked about yesterday at the chamber was you know, in 2015 and 16, we made a real big effort here in the city in our Women's Advancement Office to do more than just talk about pay equity, but actually research pay equity, get the data, and institute some changes so that women get paid the same as men, that women of color get paid the same as men, that Latino women get paid the same as men, and not their peers. That it's more consistent across the board. And yesterday we began a conversation to talk about asking companies, just a first step, we need them to step up, particularly in the African American community here in the city of Boston, to help build wealth. And Karilyn will go into this in a little bit, but the studies, and everyone on this know, everyone, the students, you probably know that the study is that the average Black family's wealth is a total of $8. The average white family's wealth, I think, is $267. A lot of that is access to capital, access to be able to build and buy a home. And folks they're either underemployed or not employed. And we have to do better to create opportunities for people to be able to move into a middle class. So it's kind of challenging the business community. Some of them have done some great stuff. There's many levels that we can be asking the business community. For example, when I've talked to the banks about creating lending programs for first-time home buyers, for people of color that might not have the best credit line or might not have the ability, how do they get access to capital? Working with the city of Boston. We also declared racism as a public health crisis, and Marty can talk about that in a little bit, but there's different aspects of that. One is health, obviously, health inequities. One is housing instability and inequities. Others, economic development, education. So there's other aspects that we're working collectively here with.
Thank you. Well, Dr. Crockett, now you can make the Martys look good. The mayor put you in charge of the Boston Racial Equity Fund. And one of the issues that you've stated, which the mayor just talked about, wanting to address, is the substantial wealth divide that separates white households and Black households in Boston. And I think the data that the mayor cited is worth repeating, that the average Black household in Boston, in this region, has a total net worth of about $8 on average. And the average white household has an average net worth of almost $250,000. How do you intend to tackle this enormous problem through the fund and through your work?
The perfect question, Alan, and thank you for having us and for the entire Tufts community to be in conversation on these issues that matter so much. So we are in the midst of a structural crisis, as much as we are in the midst of a public health crisis, or a crisis of racial reckoning, and also an economic crisis. And so what it takes to address a structural crisis is structural change. I appreciated your question to the mayor earlier, which is kind of how do we address the fact that we are dealing with a crisis of national leadership and direction in terms of what to do in the midst of the coronavirus. Boston, like many cities across the country, are stepping into the void, providing leadership for health, for well-being. And so the Racial Equity Fund is a part of how we're thinking about structural change. And so you don't just get change by writing a check. You get change by setting a new course, a new moment of direction, a new true north. And so what we're faced with in this moment is saying, what else can government do beyond government? How can government stand up, set a table, have a conversation that's about understanding at the deepest level of structural racism? What must we do? As we think about health inequities, what must we do to think about how do you really extend people's lifetimes? How do we think about all that we've done to make these inequities actually affect how long people can live. Like that is unacceptable. And then also on the economic front, there's much more to do in terms of wealth building. So that the stat that you cite from the Fed's 2015 Colored Wealth Report is a well-cited data point. Why are we still talking about it? And what have we done to close this gap? And so the Racial Equity Fund takes the racial wealth gap, takes these life outcome questions as a center of the work and asks us, what are we actually going to do? And what are we going to help ourselves understand in terms of the nature of our work? In government, we have some work to set a table and let people know what's important, but we can't do it alone, which is why it's so important to have partners like Tufts and folks in the education world as well to kind of really roll up their sleeves with us. And I definitely want to just shout out really quickly before your next question, Alan, all the tremendous students and faculty who are in this call. I think a former student of mine, Annie Califf, is here, MIT grad, who we're so proud of, and have had a bunch of Tufts students who had actually done some work with us also at MIT. So we really depend on new folks really engaging with us as well, and so welcome the opportunity to work more closely as we build new strategies.
Well, we have terrific students, and thank you for recognizing that. And we have a summer internship program, so where we pay the stipends to the students. So we'll be.
I need some help. We got big problems over here. Send some students my way, please.
Let me ask you one follow-up question, if I may. Boston's never been perceived as that welcoming to Black people, and I know there's been a lot of progress made, but there's a lot of progress yet to be made. And the entire nation is now coming to grips with deeply ingrained and systemic racism that's been revealed by the needless killing of Black and brown people by police and others. What can the chief of equity do to create, not only deal with sort of the disparities of wealth and income and services, but what can you do also to make Boston make the Black community feel like more integrated into this city and more important to this city?
Sure. You know, Alan, the real question here is calling out anti-Black racism and this larger structure of white supremacy that we're situated in that would convince us that racial hierarchies are a normal and natural way to organize society, which we know is not the case. And so the fact that the mayor has had the leadership of calling out racism as a public health crisis and emergency gives us a new opportunity to truly call out white supremacy as a problematic structure that's problematic not just for Black people, but also for white people, for people of color, for all of us. And so the fact that you could assign someone's worth and their opportunity based on melanin or lack of is a scourge, is a toxin in the root of our society and the root of our nation, our history. And so that's what we're calling out. And so it's not about really singling out a particular group of people, white or Black, but it's a system that we're all implicated in, all of our structures, our governmental structures, our educational structures, and our health structures. And we have to continue to shine the light on that. And that's my charge.
Thank you. Thank you. Let me go back to Chief Martinez, if I may. It's going to be winter soon. What plans do you have for helping Boston residents get through the cold and snowy months? And how will you try to protect the city's most vulnerable who are homeless or dealing with addiction or in need of mental health services?
Yeah, I mean, I think there's no question that when as the weather turns, good old New England style, as the weather turns, those who are the most vulnerable, who need the most support, are the ones that we need to focus on. And that's been really a key part of the COVID work that we've done in the city. The mayor's leadership early on was clear that we cannot let our homeless community not be overly impacted and not be supported. And so that has meant, even through COVID, we lifted up temporary shelter space for folks who test positive. We lifted up isolation space we lifted up additional space in different neighborhoods so we could de-densify our shelters and get people off the street and out of places that could make them more vulnerable. So moving into the winter, it's sort of doubling down on that same work. I mean, the mayor, through his work, has really made sure that our shelter system is not just a shelter system, but is a system to get people into housing. And so that's been happening through COVID. We continue to do outreach on the ground, on the streets with individuals all through COVID. Our outreach workers were essential workers throughout all of this because people needed care and support. So we're working right now to not only have overflow space for folks to get off the street and into spaces, but also to work with people who might be in the facing our other epidemic that's in front of us, our substance use disorder epidemic, and folks who are in the midst of that illness and disease. I'm sure as you know well, and others do, that didn't go anywhere. COVID may have come, but for folks in the grip of that disease, that didn't change the life circumstances they were in. So we've had to focus on that across the board and have done, I would argue, a really good job as a city to keep folks protected and safe. And now moving into the winter, we have to continue to do that, access to care, access to shelter, and making sure we continue to contain COVID for those who, when we say now, stay home, don't go anywhere, for those who don't have a home, that's easier said than done. So we have to do the work necessary to get people the care they need. So we're going to continue to focus on that as it gets cold along the way.
Thank you. Mayor, you mentioned the color coding that the state's Department of Public Health uses to designate each city and town by the color gray, green, yellow, or red based upon the average daily incident rate of coronavirus cases per 100,000 people over the previous 2 weeks. That's the formula. And you did mention that the city is going to go from the yellow zone to the red zone. Let me ask you the question that the Boston Globe asked in a headline. What will it mean if Boston shifts into the red zone? And also, what can the city be doing in neighborhoods like East Boston and Dorchester and Hyde Park and Rosendale that already have higher positive test rates than other neighborhoods in the city?
Yeah, let me just, first and foremost, one thing that we believe in Boston is in science and data. And we're looking at that data and that science, and we're bringing resources to the communities that's needed the most. East Boston was a hotspot in August. We had a targeted outreach for testing in the neighborhood, and our new positive test rate in East Boston right now is actually it's up to 7% today. And we've been working, it was as high as 11.4, 6 or 7 weeks ago. We got it down to 7%, and it's been kind of fluctuating over the last couple of weeks here. We brought more mobile testing to free testing to our communities in our hardest hit areas right now. In Grove Hall, providing free testing. I'm going to ask Marty to jump in here in a minute and talk a little bit about the trends that we're seeing. But really, like when you think about schools, and for the students that are listening, the state has metrics. I think it's red, yellow, green, and maybe gray. I'm not sure if that's there. Marty knows it better than I do. We have a metric that we're looking at for the last 14 weeks. We've been roughly averaging about 2.2 to 2.6% positive rate for COVID testing. We talked about it. We're at 3.5% testing. It's the highest we've seen, quite honestly, I think, in 14 weeks here in the citywide. So we're monitoring that, and we're working targeted inside different neighborhoods. We've put a metric, for example, on schools. Schools reopen tomorrow in Boston in a hybrid model, opt-in for parents for the highest need students. Our metric, our model isn't the state's red. Our metric for model for shutting the schools down is at 4%, or not opening up another phase. So I'll let Marty go into a little more technicality there, but certainly we don't want to be in the red. One of the reasons, unfortunately, we're in the red is because of college students, and we're asking college students to be responsible when you come to the city of Boston. And I want to see college students back in Boston. I was supportive of it from the very beginning. I thought it was really important. Tufts was on the call, but it is their responsibility also not to be gathering in large parties, not to be spreading the virus, even though young people feel that they're kind of immune, they're not going to get really sick with the virus. It's not about you. It's about the people that you come in contact with. But let me have Marty explain a little more about the way we measure what the state's doing and what we do in the city.
Thank
The
you.
only thing thanks, Mayor. The only thing I would add to that, I think, to the mayor's point, is that I think that looking at the metric around testing, around can we contain COVID, is a super important piece to look at. I mean, we are living with COVID, and I say this probably more than people love, but we are going to live with COVID until we have a vaccine, and then even after a vaccine, we're going to live with it. So in order to live with COVID and have elements of life continue, we have to monitor our data. We have to give people access to testing. We have to make sure our hospitals can take care of folks who have a severe impact, which is why we look at emergency room data every day. We look at ICU data every day. And so I think the map is one indicator that the state uses, but along the way, and I say this to the community watching, but I say this to the mayor as well, is that the mayor has placed science ahead of all else, science and public health data, even when the decision making has been difficult, which I think is how we contain COVID and place the priority on the health and well-being of all Bostonians. So that's what we're trying to do.
I know the mayor's commitment to data. I've been in his office and I've seen the screen, and I'm sure that the categories are probably different now, but the screen is probably still up there. I'm going to ask one more question, and then we have some questioners in the audience. But I have to ask the mayor a question about sort of the national political scene, if you don't mind, Mayor. You're all in for Joe Biden. In fact, last night you invited supporters to join you for a virtual debate watch party. What was your reaction to the debate? If you would share that with us.
Yeah, thank you. I mean, I was embarrassed in some ways of the performance of what the president, how he conducted himself last night. There is so much at stake right now in our country. We have an administration in Washington who didn't have a plan on COVID, and our country has paid the price. 200,000 Americans have lost their lives, nearly 30 million people are unemployed. The virus is still very much with us, and we're seeing a little increase here in Boston today. People across this country and your students, where they come from, people are worried. They're worried about the future. They're worried about small businesses. Some of the students here are worried about where they're going to go to work when they graduate. They're worried about taking care of their kids, other family members, and making sure they're learning. At the same time, we're at a very pivotal turning point in our country. The pandemic, as we know, in the beginning of this year, has shined a light. Let me just quickly tell you this. So in January, February in Boston, we're cruising along. We're moving along here. We have an incredible economy. We're building housing. Unemployment rate's the lowest it's been. The unemployment rate in the communities of color is the lowest, almost the lowest it's ever been. We're working on creating job programs and training programs and all of that. Then the pandemic comes. And what the pandemic did was shine a light on the ways that systemic racism continues to affect everyday life in a real way. People were making their voices heard. And we're moving along through the pandemic. And then 5 months ago, George Floyd gets killed. And now we have racism and racial unrest at the top of the mountain. And it's been, for years, it's been near, but then it gets pushed off the mountain and it comes back on the mountain. And we have a leader in Washington that, rather than trying to unify the country, wants to divide the country. And that's not what we need. What this moment calls for is real leadership. What this moment calls for, and quite honestly, this is not a Democrat-Republican moment, although it is a Democrat versus Republican. This is a moment for leadership in our country. When I watched the debate last night, we all watched it. I watched bits and pieces of it. It was probably the least amount of policy ever discussed on a national stage for President of the United States of America ever in the history of our country. When you start to talk about families and start to talk about the loony left, and you start to talk about all these different things, and when you ask the direct question about white supremacy, and you can't answer that question as the leader of the United States of America, that says it all. And this isn't about Joe Biden, although it's bigger than Joe Biden. This is about the future of our country. This is, and I said this many times, this isn't about you, Alan, or me, or Marty, or even Karilyn. This is about the next generation. It's about the next generation and where our country's going. So I was not impressed with last night's debate. A lot of the commentators said afterwards that Joe Biden shouldn't get on a stage with Donald Trump again because of what he pulled. And I don't believe that. I think he should get on a stage with Donald Trump again and talk about what this country needs and the leadership this country needs moving forward. When Ferguson, Missouri happened, I was the mayor. President Obama brought myself and mayors from around America to the White House, Democrats and Republicans. We sat at a table. We talked about policing. At the time, it wasn't necessarily one of those conversations very popular. It never is. But he said, we need to do something about policing. And he put together something called the 21st Century Policing Report. And it wasn't forced on anybody. It was collectively put together by a lot of different cities and towns across America. That's the type of leadership we need. President Obama opened the door. It didn't matter. He didn't ask you, you're a Democrat, if you're a Republican. He said, come into this room, sit in this room, and let's have a conversation. That's not happening in Washington today, and that's hurting our country.
Thank you, Mayor. Thank you. We have some students questionnaire. I'm going to start with Alexandra. Please give us your name, your school, and ask your question, ending with a question mark.
Sure. So my name is Alexandra. I am in the Urban and Environmental Policy and Planning program as a graduate student. My question is, has the municipal financial loss during the pandemic inspired a search for other alternative revenue streams?
Great question. Thank you for that. We have cut about $65 million out of the budget. We've been able to manage it by doing a hiring freeze. We've been able to manage it by not doing some, not the collective bargaining increases we've done, but by holding some of the collective bargaining increases. The economic crisis that I think that municipalities are going to face isn't in 2021. I think it's going to be in 2022 and 2023. As we think about how we build our budgets for the next cycles, we really have to make some really thoughtful decisions on how we move forward. We didn't lay anyone off in the city of Boston during the COVID pandemic. 18,000 people got paid, and we didn't add to the unemployment rolls, which is important. But as we think about moving forward, the lost revenue in our hotels, the lost revenue in our retail, the lost revenue in our property tax, those are things that are concerning me down the road. So we're starting to think about how we replace them. I think it's going to be very complicated as a city. We've suspended a lot of our fees. It's going to be very complicated as a city. How do we increase our fees in the business community that have just been devastated by the loss of customers and revenue? So I think we have to be very creative, number one. And number two, I think the federal government, they did the first CARES Act. The federal government needs to step up and fund states and cities across America to help them get out of this. We can't deficit spend here in Boston or Massachusetts. We have to have balanced budgets. The federal government is right now under Trump is just printing and printing and printing and printing money. And unfortunately, the next generation is going to have to deal with the deficit. But right now, we're at a time where we need major investment from the federal government.
Thank you. Next question is from Kayla. Hey there.
Hi. Okay, so well, first of all, I just want to say thank you to the Dean for your comprehensive questions, because you took my question. So I have another one, which is, I mean, I think it's impossible to govern without your identity in play with how you make your decisions. So for the mayor, I was wondering how you think your gender and your race has affected your decision making and your reaction to calls for anti-racist actions by government officials, and also just to the COVID-19 crisis.
Yeah, thank you for that. I think it's also life experiences and what you've done growing up and the experience you've had as, you know, in my life, whether it's been pre being elected official, post being elected official, my growing. I am a firm believer when you're governing as a leader, it's a collaboration. It's not led from the top down, although, you know, my name's on the door and I'm the mayor, but I honestly feel that I take very seriously what the folks around me have to say. So a night after George Floyd was killed, I was probably at one of the lowest points mentally that I've ever been in my life, because I felt as a mayor, as a white man, how do I come up with the right words to say at the right time? And what I decided to do, one of the things I did was I had a conversation with the Black employees here at City Hall. We did a Zoom call. We had about, I don't know, 100 people on the call. And I just listened. And I was listening to the pain. I was listening to the anguish. I was listening to, here we are again at the same time where this has happened more and more and something hasn't been done. And I really feel that as a mayor, whether I'm a white mayor or a black mayor, Latino mayor, Asian mayor, man, woman, it really is about listening and collaborating. That's how governing should be. What we saw last night on a stage, I think they were in Cleveland, that was not governing. That was a dictator speaking to us. And I think that it's important to collaborate.
Thank you. Megan?
Yes, hi, my name is Megan and I'm a sophomore here studying economics and political science. Thank you so much. Mayor Walsh, I have a question for you. What is the city currently doing now to help both people in danger of being evicted, those who have lost their jobs who can't make next month's rent or even last month's rent, and also landlords who have housing bills to pay?
Great question, thank you. We were Boston in the beginning of COVID. We were the first city to put in an eviction moratorium here in the city of Boston. We reached out to the banks immediately to talk to them about creating opportunities for homeowners that own property, not the big property owners, but the homeowners that own a single family, two family, three family, to come up with a product that they could delay their payment of mortgages 2 or 3 months. And Bank of America was the first one to step up. And I think we had 14 to 15 lenders that worked with us on it. Through the first round of moratoriums, we recognize, or the moratorium, we recognize that as this comes back online, many people were still paying their rents because they were on unemployment and getting the additional $600. But what we found out was that, quite honestly, families that weren't able to access federal assistance and weren't able to access federal programs, we created a rental assistance program. A lot of immigrant families that weren't eligible for anything. So we put together $3 million and we increased that, I think, to $6 million. So that was in the first phase of COVID. Right around June, when that first moratorium ended, we then extended our moratorium through the end of the year on any property that we have in the city of Boston through our housing authority. So we have eviction moratorium in place through the end of the school year, into the end of the year. The state extended that, I believe, through the end of September. I had a conversation with the governor today to have some serious conversations. We have major concern about renters in the city of Boston, that when the moratorium ends, what happens to them? And what we don't want to see, we did set up a program, a $8 million program to help people with back rents. We've spent about $3 million of that. We have $5 million left. And we also are concerned about foreclosures on property. So we're gearing our housing department to be able to expect an increase of volume of concern and be able to address those one family or one homeowner or one renter at a time. And we're working on that. I would suggest to all the young people, people on the call, I mean, I think that having a moratorium extended through the end of the year would be nice, but we also have to consider what do we do with the homeowners that might lose their homes also. It has to be a two-part solution.
We're going to go to a quick lightning round. I want to ask each of you to comment on something before we close out, if I may. And I'll ask each of you, and I'm going to start with Dr. Crockett, if I can. So how will Boston be forever changed by this pandemic? What will a new normal look like? And what have we learned from this experience and how will we use it to affect life in the city post-pandemic?
Unfortunately, the coronavirus pandemic has provided us with a horrifying and kind of heartbreaking brief on what it means to deal with the disproportionate impact of crisis and disease for Black and brown folks and immigrants. And so what it means to be on the other side of that is to be really intentional and focused about transforming, I would say, government practices and policies, and also in the education world, what can we do to make sure in partnership that we are prioritizing and serving these populations that have been devastated, not just through this latest public health crisis, but the ongoing public health crisis of racism, and all of the hundreds of years that these communities have been built up resiliency to survive. So the question for us is, what does that equitable and transformative recovery look like? And what can we do wherever we sit to make that real and manifest right now? So the success is extending the life outcomes, opportunity, and prosperity for an entire generation of folks who are young people right now and are demanding and looking for a different kind of future. We have the power to commit to that right now. And so success looks like saying yes to it.
Thank you. Chief Martinez? What
I
will
guess
the
I
new
can't
normal
say
be
that.
like?
I can't say that Dr. Crockett took my answer because that's, but that's what I want to say. The only thing I'll add to that, Ellen, is that I think, you know, we look at disparities every single week. We look at data by neighborhood, by race, by ethnicity, and we respond to those inequities around COVID, whether it's increased testing, whether it's isolation space, whether it's better prevention messaging. And I think that our advocates and our community leaders and others, including the mayor, want us to have that sense of urgency about all inequities. We've been doing it around COVID day in and day out for months, and we'll continue to do it. I think that what will change moving forward is that we have to have that sense of urgency about all the places where all Bostonians need to go and where there's gaps in making sure that there's those opportunities for everyone. I think the sense of urgency is what likely will change us moving forward.
Mr. Mayor, I'm going to let you have the last word. Tell us a little bit about what you think the new normal is going to look like and how Boston will be forever changed by what we're going through now.
The new normal can't look like yesterday. The new normal has to be very different. Along with the pandemic and the systemic racism in this country, the pandemic has changed the way we're going to do business, I think, in a lot of ways. Marty touched upon it, Karilyn touched upon it. I think for the foreseeable future, for the next bunch of years, we're going to be social, physical distancing, wearing masks, and being very careful to keep the coronavirus down. I asked Marty that question the other day. When is this gone? He said it might never be gone. So I think we're going to have a different type of normal there. When it comes to racism and systemic racism and the challenges that we have in our country, we have to address it on a nationwide basis. But right now, I can't say that I'm confident that that will happen. So all we can do right now is focus on a Boston basis and do the work that we can to lead the country moving forward. Surrounding this team here in city government and acknowledging the work that needs to be done, but also bringing in people from outside, not just the business community, but the students here. This, you know, the question I was just asked, one of the questions asked by one of the students, I love your question about gender and race. I appreciate that. I acknowledge what you're asking me. We all have to be in this conversation together, and we have to move down the road. I was talking to a young person who works for me right after George Floyd got killed, and she said to me she was upset that the civil rights movement, that the people of the civil rights movement didn't finish the job. And what she meant was about equality across all levels of government and business and life. And I said to her, well, maybe it wasn't their job to, it's our job to, and it's your job to. And it's all of our job now to step up and to truly root out racism in all aspects of life, truly deal with systemic racism, truly deal with all of the inequities that we've been talking about in this country for the last 60 years. So to go to the new normal will be very different. It's incumbent upon each and every one of us to create that. I am not going to create that. You're not going to create that. It's going to have to be all of us creating that.
Well, thank you. This has been a really rich and both interesting, but a very rich conversation, and makes you proud to have leaders like the three of you in our capital city here. So I want to thank Chief Martinez, Dr. Crockett, and Mr. Mayor. It's always a pleasure to have you on campus. We'll have you anytime that you would like. I want to thank your Chief of Staff, Catherine Burton, who helped us make arrangements for this, and my own colleagues, Jess Burns and Shanley Daly, for doing this. And to all the audience, thank you for joining us, and stay tuned for next events, and take good care.
Thank you.